Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Lisa Jonas. Lisa began her career in women's breast health in 1998 at the University of North Carolina, Chapel Hill, shortly after completing her AAS in radiology technology. Lisa has always been passionate about providing high-quality mammography screening that is accessible to all people of any socioeconomic status. After working at multiple facilities throughout the U.S., she made her home in Minneapolis, Minnesota, and has been an integral member of the NorthPoint Health and Wellness Center team for the past 15 years. Since her arrival at NorthPoint, Lisa has been appointed supervisor of radiology and has completed her Bachelor of Arts degree in healthcare administration at Concordia College. She also obtained a clinical breast examination certification in 2012 to ensure that uninsured patients who self-refer for a screening mammogram would receive a clinical breast exam prior to breast imaging under the Minnesota Breast and Cervical Cancer Control Program, also called the SAGE program, and has taken on the role of breast health coordinator for NorthPoint. So welcome, Lisa.
Thank you so much for having me today and letting me come on to talk about breast health awareness, early detection of breast cancer, and also the importance of screening mammography.
Absolutely. Thank you for joining us, Lisa, and for being willing to answer our questions about breast health. So we'll get started. Right away, when people think about breast health, they also think about breast cancer. So can you tell us, what is breast cancer?
So breast cancer, very similar to other types of cancers that we get, is when a cell inside the breast starts to reproduce itself uncontrollably, and it starts to grow very quickly, and then other cells also start to grow very rapidly and out of control, and then they form a tumor that develops into a breast cancer.
And tell us about the signs and symptoms of breast cancer.
Well, breast cancer in its early stages, you will not have any signs and symptoms. But things that we do ask people to watch for is any changes in their breast tissue or under their arms, checking for a lump, nipple discharge, especially if that discharge is brown, bloody, or clear. Redness, swelling, skin changes. Sometimes the skin might start to retract, like going inward. Same thing with the nipple area. If you see that your nipple has started to invert, these are all things that you would want to come in and see your doctor about as soon as possible. And also breast pain, especially if it's just in one area and it lasts more than 2 weeks. We would want you to come and see your doctor about that as well.
Tell us, is breast cancer preventable?
You know, unfortunately, breast cancer is not preventable. However, there are many things that we can do to keep our bodies healthy. So, you know, just like anything else, things that we know, I don't want to really say prevent, because you can be doing everything perfectly and you actually could still, you know, get a cancer, breast cancer, other types of cancer. But, you know, try to live a healthy lifestyle that involves exercise, eating lean proteins, lots of fruits and vegetables, don't smoke, you know, try to limit your alcohol intake, things like that.
And what are the recommendations for screening for breast cancer, specifically age and frequency?
So at NorthPoint, we recommend that women start their screening mammograms at age 40 and get them annually every year. We want people to be aware of how their breasts normally look and feel, their breast, chest area normally looks and feels, and then report any changes to your doctor immediately. The sooner that you get tested, the sooner we can find out, is there something more concerning, or is everything okay? For the other thing we would like you to do is we would like you to see your doctor once a year to get a clinical breast exam by your physician. And we do recommend that women start doing that at the age of 20. But for a woman of average risk, starting mammograms at age 40 is what we recommend. We understand that there's other organizations out there that say, don't start until age 45 or don't start until age 50. However, it doesn't really make sense because our two greatest risk factors for getting breast cancer is being born female and your age. So as we get older, our risk actually increases. And also breast cancers are more aggressive in the younger screening age group, which is the 40 to 49-year-olds. So to us, it makes more sense. Start at 40 and get them annually. It is a shared decision between you and your provider about whether you want to do a mammogram every year. Some places say every 2 years. We prefer annual. We respect your decision, though. If you do decide you want to do a mammogram every 2 years because you're at average risk, we just want to make really sure that you're not going over that 2-year mark. Which is why at NorthPoint, we send a reminder letter out to you when you're due for your annual mammogram. And then if you haven't gotten your annual mammogram, a second letter will go out saying it's been 2 years since your last mammogram.
Can you tell us, how do risk factors differ among patients of color compared to white patients?
So the research data shows us that African American women are much more likely to be diagnosed with breast cancer under the age of 50 and actually even under the age of 45 compared to white women. Also, African American women are much more likely to die of breast cancer. Now, we're not 100% sure, but we do see, as we're looking, that African American women tend to start screening later than white women. They typically start at age 50 or even a little bit after age 50. We also see that they don't come as frequently. So they're going way past that 2-year mark, into 3 or 4 years since their last mammogram. And then the other thing is, sometimes it's because they just don't have access to health care. So at NorthPoint, we want to make sure that we're always offering that access. And then, of course, we do offer free mammography services through the Minnesota SAGE program. For the Asian, Hispanic, and Native American women, the risk factors are lower. But we do, see even in the Latinx community that, 1 out of about every 10 women will be diagnosed with breast cancer. And we also see with our Asian population that those rates are rising as well. And we think that's probably due to, adopting American lifestyle, the foods we eat, things like that.
And what about the LGBTQIA plus community, the risk factors for that community, specifically transgender people?
Okay. Well, I want to start by saying I am not an expert by any means in this area.
Yes.
I know that we definitely need to collect a lot more, do a lot more research, collect a lot more data, especially in the transgender, non-conforming gender population. And the reason why is because a lot of times there's hormones involved that this population takes that can really cause a lot of changes on the cells in your body. I'm going to have to just read you what the current recommendations are because I can't memorize them. So if you are a person who was born female and you still identify as female, the recommendations are going to be the same. We're going to want you to start screening at age 40, doing it every, year, 1 to 2 years. We prefer every year, but if you choose every 2 years, we do respect that. Now, when we get into the transgender population, so if you are transmasculine and you have had a bilateral mastectomy or a top surgery, your risk of breast cancer is actually very low. Having that mastectomy, that top surgery, won't completely eliminate your chance of getting breast cancer, but it's by at least 90% that it will reduce that. Now, if you're transmasculine and you have not had top surgery, your breast cancer risk is going to be similar to women in the general population, a cisgender woman. And this is if you're at average risk, meaning like you don't have a first degree relative who was diagnosed with breast cancer. So for that, we want you to follow the screening recommendations, beginning at age 40. All right, now we're going to talk about trans feminine. If you're trans feminine and at average risk of breast cancer screening recommendations depend on your use of gender assigning hormone treatments. But what I read is they're saying you would have been on those hormones for 5 years before you would need to start screening. And then again, it sounds like it would be at age 40. We know there's a lot of gaps in care. And, in this population, NorthPoint really takes a lot of pride in being an inclusive healthcare facility. We really embrace diversity, not only with the people that we see, but also with the people who are employed at NorthPoint. And what we don't know, we want to learn. We always want to do our best to provide the best healthcare and services that we can, and also provide the best healthcare information available.
So tell us, can men, specifically cisgender men, can they also get breast cancer?
Yes, men do get breast cancer. It's a very low rate. It's about 2%. So there aren't any recommendations for getting like annual screening mammograms or any imaging. It's more be aware. Be aware of your chest area, breast area. Make sure you're checking underneath your arms to make sure you don't have any lumps or swollen lymph nodes. And again, even for men, if you notice any changes, come in and see your doctor right away. Some men also get some benign conditions, but they still should be looked at. And you can't tell the difference by just feeling something. So it's definitely important to come in and get checked.
Let's talk in general about high-risk factors associated with breast cancer.
Okay, so, and I'm just going to touch on this a little bit. I'm just going to go over the most common ones. So once again, I want to stress this, that our two greatest risk factors for developing breast cancer is being born female and your age. Those are our two greatest risk factors. 85% of breast cancers are in women who have no high risk factors. So they have no family history. They're not carrying an inherited gene. And when we say a family member, we're talking about a first degree family member. So that would be a parent, a sibling, or a child. Those are the three that put you at higher risk. Also, if you know that you carry what's called the BRCA1 or 2 gene, a lot of people call it the BRCA gene. And then there are other ones that they're learning can increase your risk as well. And then the other one that we've learned over the last several years is women who have what we call dense breast tissue.
And so let's talk about mammography or a mammogram. What is that?
Yeah. So a mammogram, in the most simple, basic terms, a mammogram is basically an X-ray of your breast tissue. So with the screening mammogram, here in the United States, we have the traditional, what we call two-dimensional mammogram. And then there's also the three-dimensional tomosynthesis mammogram, which is really the gold standard now for a mammogram, is that 3D tomosynthesis. So when we perform a mammogram, when you go in, you have it done, the procedure itself is very quick. To take the images really only takes about 5 minutes. When you go to your appointment, expect to be there for about 20 to go over history, fill out some paperwork, things like that. They take two images of each breast. So 2 will be from top to bottom. There's a compression plate. There's a little bit of compression that's put onto the breast tissue. That's so we can see through all the different tissues inside. And also to reduce any blurring, because we don't want any movement to occur. The other 2 are what we call angled views or oblique views. And in these views, we are including all the breast tissue that starts up at the collarbone, down along the pectoralis muscle, and all the way down to the rib line. The only difference that a patient will notice between a 2D and a 3D mammogram, the views are the same, the amount of time it takes is the same, is that when the machine takes the image, instead of just doing like a straight X-ray exposure, the machine actually will arc across the breast. And what it's doing is it's taking little individual 1 millimeter pictures throughout each breast. I guess the best way to explain it would be a 2D mammogram. Pretend like you've got a book in your hand. A 2D mammogram is kind of like you're looking at the front and you're looking at the back. A 3D mammogram is you have a book and you're opening it up and you're looking at each individual page. So you're able to see through all these different layers. And because of that, 3D mammography catches about 41% more cancers than 2D mammography does. And we highly, highly recommend it for people that we know have that dense breast tissue, because looking at things page by page, layer through layer, they're able to see through what we call this dense breast tissue better.
Thank you. And so speaking of what you mentioned before, dense breast tissue, can you tell us how anatomy might affect your chances of developing breast cancer?
Yeah. So first off, let's just talk a little bit about what breast tissue is made up of. It's made up of glandular tissue. This is where the ducts and the lobules are that are there to develop milk. And then we have our connective and fibrous tissues, which help support the breast. And then we also have fatty tissue. When a radiologist reads a mammogram, there are 4 categories of breast density. So for people who fall into the 2 categories that are considered dense breast tissue, what that actually means is that on the mammogram, the breast tissue looks very white. It's hard to see through because there's a lot more of this glandular and fibrous tissue than there is fatty tissue, which is much more easy to see through. So with the 2D mammogram, it could be possible that something would be hiding in there that they couldn't see. And maybe, a year or 2 down the road, this thing has grown and then they catch it. Where with 3D mammography, because they're able to look through layer by layer, it's much more likely that they're going to catch something early. Screening mammography is specifically to look for really small breast cancers before you have any signs or symptoms. You won't be able to feel it. You're not going to have anything unusual going on. When we catch cancers at these very, very small stages, they need the least amount of treatment, and the survival rates are about 99%, meaning it's very, very unlikely that you would die of breast cancer. Typically, it would just need a surgery, maybe some radiation therapy.
Thank you. And so thinking about cancer, breast cancer diagnosis, it might be difficult to talk about treatment because you'd mentioned that treatment can be very specialized or specific for a person. But just tell us, what are the most common types of treatments for breast cancer?
Yes. Breast cancer has, the treatment for breast cancer has really come a long way over the years. A long time ago it'd be, you're just getting a mastectomy and that's it. But now as we're learning so much more about breast cancers, different types respond differently to different medications. So it's very individualized now. It's like they basically make you your own special cocktail.
Sure.
But the standard would, if you're catching something very early, would most likely be a lumpectomy, meaning they just take out the area in the breast where the cancer is at and the surrounding tissues, just to make sure that they don't leave any cancer. And then probably some radiation therapy. If something maybe is a little bit more advanced, they might go for a total mastectomy, and possibly some chemotherapy. If a lump is found and it's larger, sometimes they might want to do IV infusion chemotherapy, which means they would want to shrink the lump before they did any surgery. But for things that are caught small, they don't do that. So let's say you were in a stage that was maybe a little bit more advanced, maybe a 1 or 2. It might be that you need a mastectomy and then do an oral chemotherapy that you would take for a period of years after. So, and I don't like to talk about it too much because, like I said, it's going to be different for every single person.
Absolutely.
And I think the other thing that I like to tell people too is, we know breast cancer isn't preventable. So if you get breast cancer, just know it's not your fault. It isn't anybody's fault.
Yeah.
It's just a change of cells in the body.
Absolutely. Thank you. And so this is, something that NorthPoint has services for. So tell us what patients can expect at NorthPoint for their breast health.
Okay, so NorthPoint, we are a primary care clinic. So that means that you can come in, you can see your provider, get your breast exam, have your mammogram, and we do offer both the traditional 2D and the 3D mammography. We also offer these services for free to people who are eligible. Typically, it's for patients that don't have any insurance or are underinsured. We partner with the Minnesota SAGE program, which is the Minnesota Breast and Cervical Cancer Control program. So if you qualify for that, you get to see your doctor, you get to have your mammogram. The other thing is that with this particular program, let's say the results of that mammogram came back and the radiologist like, gosh, we got to get some more pictures. We think something doesn't look quite right. The cost would also be covered by the SAGE program. And because we have dedicated breast health coordinators at NorthPoint, someone is going to be there to help you through that process of scheduling that appointment. If you need to get these additional views, because they would be done outside of NorthPoint, that would be something where we would have to send you to a dedicated breast center.
Absolutely. Great. Is there anything else about breast health that you would want our listeners and viewers to know?
Oh my gosh. I just want to say, see your doctor. I think it's so important that everyone see a provider annually, not just for your breast health, but just to have that annual physical, see your provider, stay on top of your health care. I think that's just really, really important, and get that mammogram annually. I really think it's important that people get that annual mammogram. We really want to catch things early when it's the most curable, needs the least amount of treatment. Oh, and we also, you don't always need to see your doctor before your mammogram. If you're not having any problems with either breast, you can just call our radiology department directly at 612-543-2677 to schedule your mammogram. But if you're noticing any signs or symptoms, definitely have to see your doctor first, get that breast exam so that they can order the appropriate tests.
Wonderful. Well, thank you, Lisa Jonas, for joining us and helping us understand more about breast health.
Thank you for having me.
Absolutely. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the door,